We have with us Vicki. Say your last name for me,
Breitbart.
Vicki. Say it again.
Breitbart.
Great, and she's going to talk very loudly for us, the director of the Health Advocacy Program. And what does it do for us, the Sarah Lawrence College?
Right. Sarah Lawrence College has a master's program in health advocacy.
Oh, that's what it is. Okay,
Yes.
You're not the advocacy program itself, but you're teaching people how to start them and how to run them and how to contribute
Yes,
to
exactly.
them.
It's a master's program. It's a 2-year program, and they go through health law and ethics and policy and really know how to be advocates for individual patients or community organizing or for policy.
And what is your role in that program?
I'm director of the
You're
program.
the director of it.
Yes.
So I would think that you must sleep very well at night because you're not advocating for just one thing, which is a really great reason to sleep well at night. You're making a huge community, a huge commitment, and a huge contribution. But you are training people to do it so that your reach actually extends very far.
I will say yes. I have my own concerns, and a lot of it has to do with the staggering impact, that people can have working for their own rights and for patient rights. But how to make the curriculum so that people really have the skills and the information they need to do that, because it's a huge, as you know, a huge healthcare system that seems very impenetrable at times, and so it's a really developmental how you can do the skills that are necessary to make that change.
Well, right now we have all the social media and many sites that are giving us information about patient and healthcare provider needs. They're telling us what their issues are. So then how do you translate that for the people who are in your program? Does it seem massive?
It's a very big undertaking, but they really learn sort of how the system works, how the healthcare system works, where are the points of entry, where you can actually make a difference. They talked about that social media really has to be directed towards action, and our advocates really know what kinds of actions, what kind of strategies, what kind of interventions to use with what kind of audiences, when and where. So it's those kinds of skills and knowledge that people really get. It's very inspiring what our students do.
Oh, I see. I hear it. So is there an example of someone who graduated from the program or an advocacy group that's out there as a result of someone graduating from the program?
Well, a variety of things. We have someone working now on developing an app for parents with chronically ill children so that they can really use that app for ongoing monitoring of their children's situation.
And it's at their fingertips, in their pockets, in their pocketbooks.
And using social media is one of the things that we really look at for our students to be able to sort of manage and develop.
That is so great. It sounds to me like you would be a great panelist here one day telling everybody how to do better what they do. So thank you very much for joining us.
I want to introduce an alumni of our program.
Oh, Sarah!
Right.
Come right on in.
Thank you.
Sarah, you are working with Global Healthy Living and
Yes,
Creaky
I am.
Joints. That must have been such an incredible opportunity and
It
gift for
was
you.
a deep inhale and exhale, finding a place where what I learned at the Sarah Lawrence program really come to life.
So you you helped plan this conference.
Yes, I did.
See what you did? You helped.
That's very inspiring.
You helped
Right,
plan
exactly.
this conference. And the great thing I noticed about people who work at Global Health Living and in other advocacy groups is you live for the cause. You don't have a job. You live for the cause. You have a calling to do this. Am I right?
Absolutely.
So where does that come from? What made you want to do this?
Well, Vicki knows very well that my best friend from childhood, she recently passed away from breast cancer, and going through her process with her, I truly felt called.
Yes, absolutely, and I'm sure that she is up there somewhere thanking you for your service to her, and her family, I'm sure, is so grateful for you.
And I am thankful to the Sarah Lawrence program because it really helped me understand and be a better friend to her.
Oh, wow, what a great, this is such a moving moment. Thank you both so very much. Now, what's the biggest goal you have going forward now, moving with the Advocacy Summit and what comes after this? You're going to have a big responsibility. Can you spell follow up? Okay.
Yes, follow up, please.
Okay. You'll hear from Sarah about what kinds of things she will be offering you, what kinds of things you can give them as a result of what they've heard out there and learned and what was worth it to them and what we might need to work on for the next one. But I didn't say that one too loudly because so far so good.
Yes.
Thank you so very
Thank
much.
you so much.
Thanks.
Thank
Thanks
you.
to both of you. You're terrific. Thank you. Thank you.